I'm Marilyn Coruzzi, and I'm an internist, and I'm living here in Sitka, Alaska, Southeast Mountainside Clinic, which is associated with Sitka Community Hospital. I've always been interested in Native culture, and for many years kept little clippings about Native physicians or physicians in Native hospitals. And so the time came when my husband and I both agreed to take a chance, and we moved to Kotzebue in the Arctic. And I worked there at the Manila Health Center as kind of a family doctor, doing a little bit of everything, obstetrics, orthopedics, family care. The part I enjoy the most, being an internist, is following patients over a length of time and being their family doctor and kind of setting a foundation for the time when they may become very ill, and that I can give them comfort and that they know they're in the hands of a friend. The difficult part, again, as an internist, is being in Alaska. You take call in the ER periodically, and you have to be able to at least begin to care for many different problems that you're not going to run into in a more urban setting. So you may have a month-old baby, or you may have an elder who's broken his hip, or be very perplexed, and we have very few specialists. So we talk on the phone a lot to Seattle. I remember I was about 14 and began thinking about what I wanted to do with my life, and that I wanted to do something that gave me joy and a sense of accomplishment, and just began thinking about a profession that involved caring for people. I think as a physician, you have an opportunity and a joy to learn from the people you care for. And so I took care of an older nurse, and as she faced a terminal illness, I observed, how I might want to try to deal with it in my life. I counsel my sons, make up your mind, and then don't think about the obstacles at the beginning. And you just make up your mind, and you kind of hit one obstacle after another. When I was training, women were not very common in medicine. So I ran into some difficulties, like why on earth, as a woman, do you want to be a doctor? At the medical school I attended, there was a little older woman physician, so she, I think, made it easier to envision that you'd be a doctor. And then the patients I cared for, who were very welcoming, and it didn't matter what culture, what race we were, that we kind of spoke a common knowledge.